Now,
I cannot see it, but
one of the charts, it's a bar chart.
Well, let me just see if I can just look at it because I cannot see properly. But in any case, yeah, okay.
I believe this is the one that we have.
Okay, yeah. We could find that there is a cholesterol level, which is first one, that prior the patient or the subject start the treatment.
That's the first column.
First one column, okay? That's 2 weeks later, you will find the red one again, which is really twin with it. It's going down. It started from 7.5, the cholesterol level. It turned to become 6 after 2 weeks only, okay?
So that's a person that has cholesterol problems that went on the this certain program.
This is, I'm taking the average of 60 subjects, 60 patients, if you can call it patient, but I call it subject now.
So the red ones are the cholesterol
level. So there is decreasing. Now we go to triglyceride, which is very bad type of fat, which really contribute to a lot of diseases of the heart. And we'll find that from 5.5, it decreased to really almost 4 triglyceride. Again, there is a highly changes in the level of triglyceride, bad fat, which is going to becoming down. Let's go to glucose level. I mean, the yellow one. The yellow one, the average, which had around 13 millimole. Then the normal level should be not exceeding 6 millimole. But after 2 weeks, we found that these patients from 13 gone down to almost 8.
Wow, these are remarkable results.
This is, of course, this is a study which I'm doing it with my colleagues in the Faculty of Medicine. This is really very fascinating and amazing things which is occurring really with such type of people.
Of course. And Professor, I believe we have another phone call right now from also one of your fellow colleagues, Professor Abdurrahman Al-Awadi. Abdurrahim Al-Awadi, I'm sorry.
Mr. Abdurrahim Al-Awadi.
Hello.
Hello.
Mr. Abdurrahim, you're on the air.
First, I'm not professor, by the way.
I just corrected that. I'm so sorry.
I'm one of his patients. I think he has proved really something unbelievable. I was overweight. I went to him last Thursday. Within a week, I lost almost 4 kilos. My cholesterol has come down tremendously. My blood pressure has come down. And I think this is really revolutionary system which doctor is using. Is really fascinating what he has done to everybody. I'm one of them.
And do you have a feeling of well-being? Do you feel that it's actually...
Definitely. Feel very active, feel relaxed, feel really regenerate your way of life.
And you had no problems with this? How long have you been on this certain dietary program?
From last Thursday, just 7 to 8 days.
7 days, and you've managed to lose 4 kilos.
Exactly, yeah.
Wow, I think that's a marvelous accomplishment. And also, as you just mentioned, have you managed to cure certain diseases, or has it managed to help any diseases that you have currently?
It's not a disease. It is a normal thing which everybody has in my age, which is cholesterol. Blood pressure, all the other things. Everything which was above the average has come down to the level which is, I think doctor is very happy with what he has seen within a week.
Well, definitely. We would like to thank you very much for your phone call, Mr. Abdurrahim. Thank you very much. Thank you.
Thank you, Mr. Abdurrahim.
Professor Hussein, this is a major accomplishment. Now, a lot of people, I guess the weight loss, it depends from one person to another. Like someone can lose 8 kilos in a month, someone can lose 4 kilos in a week. I guess it's just the way the body is structured. People lose weight on different time levels or time spans. But 4 kilos is excellent, plus reduction of cholesterol levels.
There are other examples, really. I can agree with Mr. Abdurrahim. There are so many things really is occurring, and you will be surprised that this really is not diet. I don't call it diet because patients are allowed to eat as much as he wants. Of course, he's avoiding the poison. What I call carbohydrate is a poison. It's giving me energetic things, just unstabilized blood sugar in my body. It goes fluctuating, it goes up, goes down, so you are not stabilizing it. While by this program, which is ketogenic, really is going to help you to give you a stabilizing your blood sugar, makes you more comfortable. As Mr. Abdurrahim said, it's more energetic. You feel really tremendously relaxed. You are happy. You are continuing work. Your sleep pattern is improving. I'm sure there are a lot of patients which they do come, I mean, friends of mine and even the patient, they do tell me that they are really getting much better, much improvement in such conditions.
Well, Professor, now, a lot of people might be saying, okay, now can you tell us a little bit more about this miraculous program? Because now I think we just got the hint that the program itself eliminates carbohydrates and sugars. Is that correct?
Absolutely.
Can you tell us a little bit more about it, like the do's and don'ts within the program, the things that people would eat and the things that they are not allowed to eat, and how does it work on a time level, actually? Is it broken down into weeks or months?
Okay. Oh, of course, there are so many things. First of all, when as I mentioned first, when we'll have a sugar or carbohydrate diet, apparently or ultimately they will form sugar in our body, whereby the insulin will be raised and starting decreasing the level of sugar in the body. Okay? So, as I said, fluctuating of sugar, patient feels hungry after a while, he goes and he'll start having some snacks in order to make his blood sugar in proper way. 2 hours later, again he feels hungry. He goes and seeking for something to eat, fruits or things.
It's like cravings.
Craving, absolutely. So his blood sugar will be raised. So there is a fighting between insulin and sugar. Insulin comes up, sugar goes down. Sugar goes up, insulin comes down. And so this dilemma is working very badly in the body. So what we are trying to say that if I restrict my people or restrict myself to have carbohydrate diet, what happens? The storage of the sugar or carbohydrate in our body will be eliminated after a period of 48 hours, whereby the body requires some energy, some fuel. From where we can get this energy? We can get it from the fat, which for the 30, 40, 50 years we are accumulating them around our abdomen, our buttocks, and so many areas in our body. Here the body starts getting fuel. How? They start burning the fats are in our body, and burning the fat to get some fuel or energy called ketosis. And this ketosis is a program or the things which gives you first energy, can stabilizes your blood sugar. The brain loves this type of energy. The heart loves this type of energy. And there are, I don't know whether we have enough time. I could go and just give some more example of it.
Well, I believe, Professor, we have a phone call. We'll take that and go back to our program once again. Hello.
Hello.
Good evening, Mustafa. You're on the air.
Good evening, my dear sister. How are you?
I'm fine. How are you?
Good evening, Dr. Dashti.
Good evening.
Please, I'm interested in your program, but I don't know exactly what your program is about. Can you take a few minutes to explain to me, and then you give me your telephone number and email, please?
Okay, well, thank you, Mustafa, for your phone call. We were just in the process, actually, of talking about the program and its contents and how it's actually made up, in what kind of form. And if you'd like to call back anytime during the show, our control room will give you Professor Hussein al-Dashti's number. Thank you for your call. Well, actually, his question was very much related to what we're
talking. Yeah.
Because I believe that a lot of people, Professor, don't quite understand. Is it a program as in you have a set breakfast, a set lunch, a set dinner, or is it just giving you what you can have and you follow it?
Okay.
Or, a lot of people just need to understand what this is all about.
Well, what I was saying, that the ketogenic thing, so the body goes after burning this fat in ketogenic process, whereby we can get good energy, pure energy from these fats. And this fat, this energy really helps the brain, and brain loves this one. And now, in addition to this one, patient maintains his weight and start losing the weight without influencing the side effects in the body, without influencing the problem or bad effects on the body. And contrary, patient or the subject feels very, very happy regarding this one. Now, let's go. Of course, there is no much time. Let me go and just say about this program, how Mr. Mustafa was asking.
Well, Professor, before we actually